Go to GotToGetFios.com today for America's fastest, most reliable internet, Verizon Fios.
Watch News Channel 3 in high definition on Time Warner Cable Channel 603.
Welcome back. Today we are speaking with Kristi Wilkins. She is the chair of the Department of Dental Hygiene here at the Loma Linda University Medical Center. We're talking about, I guess this is the #1 health issue for adults. Xerostomia affects a third of the population, women higher at risk than men. Xerostomia, what is it more commonly called?
Dry mouth.
Dry mouth. It's something that a lot of people deal with. Why is this? It's not just, I guess, uncomfortable, but it's a problem for people.
It is a problem, and it's increasing. There are 400 medications, over 400 medications right now that cause, as a side effect, dry mouth.
And why do people need to take this seriously? This is not just something that's an inconvenience, but should be treated.
Correct. It's a quality of life issue. It affects our digestion when there's a lack of saliva. It increases your potential rate for cavities. It causes increased concerns with yeast infections if you're wearing any kind of dentures or partials.
What are the symptoms that people would look for, like if they think that they might have a problem, or if they're not even aware they have a problem? What would tip them off?
Well, about 60% of people who have dry mouth don't really realize they have it because the symptom is it's slow and it's sort of waxes and wanes, so you don't realize it. But if you're getting mouth sores, if you're having concerns with sensitivity on your gums, just a lack of your mouth feeling dry all the time, and you need to drink a lot of water.
Is that a simple treatment that might work for some people, just drinking more water? Or...
Yes, hydration, more water, fluids is a good way to help this, as well as using some potential medications that will increase salivary flow. Could also mean increasing your fluoride usage too to help protect your teeth. Okay.
Are those some of the more common treatments? Are there more advanced or involved treatments? What if those don't work, or will those necessarily work?
Well, in addition to the medications that a physician or a dentist could recommend, prescribe, there would also be chewing gum without sugar. We don't want to increase your sugar.
You could just chew gum.
Chewing gum helps, yes.
Okay.
Mints, but you don't want to use a lot of harsh cinnamon, those kinds of flavors, because that might irritate your mouth as well.
Yeah. So if people need to find out more, then I guess it's important to be seen. Is this something you can go to your just general practitioner, or what's the best treatment for this?
Your physician will know about the side effects of the medications, specifically if you're taking anti or hypertensives for blood pressure, if you're taking some mood enhancer, anti-anxiety drugs. Diabetes has concerns with dry mouth as well. So your physicians will definitely be aware of the side effect. But also the dental hygienist will notice that when she or he are cleaning your teeth, as well as the dentist will follow up and ask how to help you out as well.
And you see a lot of it, because again, they're saying that this a third of the population, so it's a lot of people.
And women are more affected than men at this point.
So, but you can get treatment for this. It's not something just to let happen.
No, don't let it go, because it does increase your rate of cavities and periodontal disease, gum disease, as well as just your quality of life and oral malodor or bad breath.
Yeah, so a lot of problems that it can breed. If you want to find out more about this, you can go online to dentistry.llu.edu, a website, and look for the patient services link, and the link should be on the bottom of your screen right there. Again, Kristi Wilkins, thanks so much for joining us here today and opening our eyes to this problem of dry mouth. Xerostomia.
Xerostomia, that's right.
The official word. Thanks so much for joining us today.
Thank you.
Top stories are coming up next. You're watching KESQ, the Desert's news leader.
The year 1984. My name? Carrie Bradshaw. New kid. New guy. I knew he was going to kiss me. I did what any girl would do.
So you have some explaining to do.